Good morning. I'm Rani Mohan, a family nurse practitioner student at Azusa Pacific University. Today, I'm presenting how to present the difficult diagnosis of ADHD to Ethan's mom, who is also present here. This conversation is challenging because parents often experience fear, guilt, confusion, and uncertainty after hearing the diagnosis. Some parents also have deeply held spiritual or religious beliefs that influence healthcare decisions. In this scenario, the parent declines the recommended medical treatment because they believe God will heal their child through prayer. My goal as the healthcare provider is to communicate compassionately, provide evidence based recommendations, and respect the family's beliefs and collaborate on a treatment plan that supports the child's health while honoring the family's values. Good morning, Ethan's mom, Mrs. Johnson. Thank you for coming in today. How are you and Ethan doing today? We are doing okay, but we have been anxious waiting for the results. I understand, Miss Johnson. Waiting for answers can be stressful. Thank you for completing the Vanderbilt questionnaires and allowing us to gather enough information from Ethan's teacher and school counselor. I appreciate all the time and effort you have put into helping us understand what has been happening. Before we begin, is this still a good time to discuss the evaluation results? Yes, delivering the diagnosis. After reviewing Ethan's developmental history, school reports, teacher questionnaires, and today's assessment, Ethan meets the diagnostic criteria for attention deficit hyperactivity disorder combined type. ADHD is a neurodevelopmental condition. Children with ADHD often have difficulty paying attention, controlling impulses, sitting still, following directions, and completing tasks. These symptoms can affect learning, relationships, and self esteem if they are not properly addressed. I want you to know something very important. The diagnosis is not your fault, and it is not Ethan's fault either. ADHD is not caused by poor parenting or by a child choosing to misbehave. It's a medical condition that many children experience, and with appropriate support, most children do very well. I would like to pause here for a moment. Can you tell me what you are thinking right now? Honestly, I'm overwhelmed. I have been praying that it wasn't ADHD. I don't want my son labeled. I don't want him treated differently. Thank you for sharing that with me, Mrs. Johnson. Those feelings are completely understandable. Many parents tell me they experience fear, sadness, or even guilt after hearing this diagnosis. I want you to know that we are partners in Ethan's care. We will work together to help him reach his full potential. Sometimes our faith and spiritual beliefs play an important role in healthcare decisions. Would it be okay if I asked a few questions to better understand what is important to you and your family? Of course. Do you have spiritual or religious beliefs that are important to you? Yes, we are Christians. Our faith guides everything we do. How do those spiritual beliefs influence the healthcare decisions you make for Ethan? We believe that God has a purpose for every child. We pray before making any important decisions, especially medical decisions. Do you receive support from your church or a faith community? Yes, we are very much involved in our church. Our pastor and church family have been praying for Ethan. Thank you for sharing that, Ms. Johnson. How would you like me, as your healthcare provider, to include or respect your spiritual beliefs while caring for Ethan? I would like you to understand that prayer comes first for us. I appreciate you sharing that, Ms. Johnson. Knowing what is important to your family helps me provide care that reflects your beliefs. I would like to discuss the treatment options that are recommended with a child for a child with ADHD. Research has shown that the most effective treatment often includes a combination of behavioral therapy, school accommodations, parent education, healthy routines, and in many children, medication. One commonly prescribed medication is methylphenidate, which is a stimulant medication. When carefully monitored, stimulant medications can improve attention, reduce impulsive behaviors, improve classroom performance, and help children develop confidence as they experience more success both academically and socially. Like any medication, there are possible side effects. These may include decreased appetite, difficulty sleeping, stomach discomfort, or headaches. We monitor children closely, adjust the dosage when needed, and schedule regular follow up visits to ensure the medication is both safe and effective. Medication is only one part of the treatment. Behavioral therapy, positive parenting strategies, consistent routines, regular exercise, adequate sleep, and collaboration with the school are also very important. I appreciate everything you have explained, but I don't want Ethan taking medication. I believe God created him exactly as he is. I believe prayer should be enough. Thank you for telling me honestly how you feel. I respect your decisions and your faith. My responsibility is to make sure you have accurate medical information so you can make an informed decision that is best for your family. Would it be all right if I answered? I mean, do you think that I answered all the questions so you can make an informed decisions? I have heard they change children's personalities and make them addicted. So I am refusing medications. Let's work together on the care for Ethan and while honoring your family's beliefs. Since medication is not something you are not ready to consider, I recommend that we begin with behavioral therapy and parent training to help develop strategies for improving attention and managing behavior. Thank you for coming in today, Miss Johnson. Thank you. That's the end of the presentation. Bye.